Have you ever wondered if something as small as your daily hygiene habits could be silently revealing serious health issues? Doctors can often detect life-threatening conditions simply by observing a few key hygiene mistakes in their elderly patients. What's truly alarming is that many seniors aren't even aware they're making these small but critical errors every single day. In the next few minutes, I'll uncover 7 personal hygiene mistakes that doctors instantly notice, and more importantly, how correcting them could truly protect your life, or the life of someone you love. The information I'm about to share with you isn't part of standard education. It's rarely brought up in doctors' offices, and almost never covered in health magazines. Yet knowing this could be the key difference between enjoying your golden years in good health or facing preventable problems that steal away your independence and dignity. Let me introduce you to Walter, a 75-year-old retired engineer. Walter was lively and deeply involved in his community, enjoying golf twice a week and never missing a chance to watch his grandchildren play baseball. He believed he was doing everything right when it came to personal care. But during a routine checkup, his doctor noticed 3 hygiene issues that pointed to a serious, undiagnosed condition that Walter had no idea was brewing. "I thought I was taking good care of myself," Walter shared with me later. "If my doctor hadn't caught those small signs, I might not be here today." Today, I'll show you exactly what those mistakes were, and, even more importantly, how you can avoid making them. These small changes could truly add healthy, vibrant years to your life. Mistake 1. Neglecting oral hygiene. When was the last time you checked your toothbrush? Is it looking frayed or worn out? Are you brushing thoroughly twice a day? These simple questions could make a big difference. But here's an even more critical question. Did you know that poor dental care doesn't just lead to bad breath or missing teeth? It's directly tied to serious conditions like heart disease, stroke, and even dementia. Researchers at Harvard Medical School have shown that bacteria from untreated gum infections can travel into your bloodstream, leading to dangerous inflammation in your heart and blood vessels. In fact, studies reveal that seniors with poor oral hygiene are 3 times more likely to suffer cardiovascular events compared to those who maintain proper dental care. Let me tell you about Marilyn, a 68-year-old retired schoolteacher from Oregon. Marilyn noticed her gums bleeding, but thought it was just a normal part of aging. "I figured everyone my age goes through this," she admitted. Unfortunately, during a regular checkup, her doctor found severe heart valve inflammation caused by oral bacteria. Had Marilyn waited just a few more months, the damage could have been irreversible. So what can you do right now? Start by inspecting your toothbrush. If it's more than 3 months old or shows signs of wear, replace it immediately. Better yet, consider switching to an electric toothbrush. According to research from the University of Pennsylvania Dental School, electric toothbrushes remove 62% more plaque than manual brushing. Make sure you brush your teeth twice daily for a full 2 minutes. Set a timer if needed to stay on track. Floss every single night, without exception, because your heart health may depend on it. Even if you wear dentures, regular dental checkups are essential for maintaining not just oral health, but your overall well-being. Have you noticed any bleeding or swelling in your gums recently? If so, don't ignore these signs. They could be your body's early warning system that needs your attention. Have you ever noticed bleeding when you brush? Or maybe some swelling in your gums? Please don't brush these off as just normal aging. They are your body's way of waving a red flag, signaling that something deeper could be wrong. Don't put off getting it checked another day. Mistake 2. Infrequent bathing and skin care. Let's talk honestly for a moment. How often are you bathing? It's very common for seniors to bathe less frequently as they get older. Maybe you're worried about drying out your skin, Or maybe it just feels like less of a priority these days. But here's something important you should know. Your skin is your body's largest organ, and it often gives the first signs that something serious might be happening inside you. Dermatologists at the Mayo Clinic have warned that reduced bathing in seniors can hide early signs of major health issues like diabetes, liver problems, and heart conditions. In fact, studies show that nearly 40% of undiagnosed illnesses in elderly patients could have been detected earlier simply by observing skin changes. Let me tell you about Franklin, a 77-year-old retired postal worker from Michigan. Franklin thought bathing once a week was enough, especially during the colder months when his skin felt dry and irritated. "I didn't want to make it worse by drying it out more," he explained. But during a routine doctor's visit, his physician noticed unusual discoloration on Franklin's skin. Further testing revealed early-stage kidney disease, something that could have been caught even sooner if the symptoms had been more visible. The issue wasn't that Franklin had poor hygiene. It was that infrequent bathing had allowed critical signs to go unnoticed. So, what's the best way to protect yourself? Establish a consistent bathing routine, ideally at least 3 times a week, even if you don't feel particularly sweaty or dirty. Use a gentle, fragrance-free soap that preserves your skin's natural oils. After each bath or shower, apply moisturizer while your skin is still damp to lock in hydration and prevent dryness. Most importantly, regularly inspect your skin. Are you seeing dry, flaky patches, unusual spots of discoloration, persistent itchiness? These could be warning signs from your body, not just harmless annoyances. Have you taken a close look lately? Don't ignore what your skin might be trying to tell you. Catching these signs early could make all the difference. Mistake 3. Ignoring nail care. Now, take a moment to really look at your fingernails and toenails. Are they neatly trimmed, clean underneath, free from any strange discoloration or thickening? Your nails are more than just cosmetic. They are windows into your overall health. Doctors often check nails first when examining elderly patients because changes can reveal hidden systemic problems. According to the American Academy of Dermatology, abnormalities in nails can indicate over 20 different underlying conditions, including anemia, thyroid dysfunction, and even heart disease. In fact, research shows that for seniors over 65, nail changes helped diagnose hidden illnesses in nearly 30% of cases. Let's look at Eleanor's story. Eleanor, at 82 years old, noticed her toenails becoming thick and yellow. She didn't think much of it and simply switched to closed-toe shoes to hide the problem. "I just thought it was part of getting older," she said. However, when she finally sought help for foot pain, her podiatrist immediately diagnosed a fungal infection. And what's more, the infection had thrived because of a severely weakened immune system. Further tests revealed a much more serious underlying condition that needed immediate treatment. What should you be doing? Keep your nails trimmed straight across, with slightly rounded edges to avoid painful ingrown nails. Clean under your nails regularly, keep them dry, and wear breathable footwear. Change your socks every day to prevent fungal infections. Never ignore changes in your nails. Are yours becoming brittle, discolored, or thickened? These changes aren't just a nuisance. They could be your body's first sign that something deeper is wrong. Will you listen to these subtle warnings before it's too late? This is perhaps the most shocking hygiene mistake because of how common it is and how desperately people try to hide it. Did you know that over 50% of seniors deal with some form of incontinence in silence? The truly alarming part is how many of them hide it rather than seeking the treatment they need. Urologists from Johns Hopkins Medicine report that untreated incontinence can lead to dangerous skin infections, falls, social isolation, and even mask serious conditions like bladder or prostate cancer. Their studies show that seniors who properly manage incontinence have 60% fewer complications than those who attempt to hide the issue. Take the case of Gerald, a 73-year-old retired accountant from Arizona. Gerald felt too embarrassed to mention his occasional leakage to his doctor. Instead, he used paper towels and frequently changed his clothes, thinking he was managing the situation. But when he finally sought help after developing painful sores, doctors discovered an advanced prostate condition. It was a condition that could have been treated months earlier with far better results, had he addressed it sooner. "My pride nearly cost me my life," Gerald admitted. "I wish I had talked to my doctor at the first sign of a problem instead of trying to hide it. If you're experiencing any form of incontinence, here's what you should do. Never be embarrassed to talk about bladder issues with your doctor. They see this every single day. Use absorbent products designed specifically for incontinence rather than makeshift solutions. Change promptly when wet, and follow a proper cleansing routine to prevent skin breakdown. Most importantly, understand that incontinence is not a normal part of aging. It's often a sign that something requires medical attention. Are you experiencing occasional leakage? Do you find yourself planning outings around bathroom availability, using makeshift protection? Don't wait another day to talk to your doctor. Your health, and possibly your life, could depend on it. Mistake 5. Ear hygiene errors. How often do you clean your ears? Be honest with yourself. Are you using cotton swabs and inserting them deep into your ear canal? If so, you're making a dangerous mistake that many seniors make every day. Improper ear cleaning can damage your hearing and cause you to miss serious infections. Otolaryngologists at the Cleveland Clinic warn that seniors often damage their ear canals with cotton swabs while also missing symptoms of potentially dangerous infections. Their research shows that improper ear cleaning is responsible for nearly 40% of ear canal injuries in patients over 65, many of which lead to infections that could have been avoided. Take Carol's story, for example. She was a 71-year-old retired librarian from Washington. Carol regularly used cotton swabs to clean deep inside her ears, until one day she punctured her eardrum, which led to a severe infection that spread to nearby tissue. "I had always cleaned my ears this way," Carol explained. "No one ever told me it was dangerous." Carol required emergency treatment and suffered permanent hearing damage that could have been avoided. So, what's the correct way to clean your ears? Here's a simple rule. Never insert anything smaller than your elbow into your ear canal. Instead, clean only the outer ear using a warm, damp washcloth. If you notice a buildup of earwax, avoid trying to remove it yourself with cotton swabs or other objects. Instead, use ear drops specifically designed to soften wax, and make sure to follow the package directions carefully. If you experience any ear pain, unusual discharge, or sudden changes in your hearing, don't wait. See a doctor immediately. Are your ears feeling itchy, full, or blocked? Have you noticed any unexplained hearing loss? These are not issues you should try to fix on your own. They require professional medical attention to prevent more serious damage. Remember, your hearing is precious. Protect it by taking the right steps and seeking help when needed. Mistake 6. Poor foot hygiene. When was the last time you really took a good look at your feet? Not just a quick glance, but a careful inspection between the toes, the soles, and the heels? You might not realize it, but your feet hold important clues about your circulatory and nervous system health. That's why doctors often check them first during exams with older patients. According to podiatrists at the American Podiatric Medical Association, poor foot hygiene can reveal early signs of diabetes, nerve damage, neuropathy, and vascular disease. Their research shows that in seniors over 65, proper foot care and regular inspections could prevent up to 85% of diabetes-related amputations. That's not a mistake. 85% could actually be prevented with simple daily habits. Let's look at the story of Leonard, a 76-year-old retired factory worker from Illinois. For years, Leonard noticed dry, cracked skin and minor cuts on his feet, but assumed it was just part of getting older. "My feet had been looking rough for a long time," he admitted. Luckily, during a routine checkup, his doctor paid close attention to his feet and immediately ordered tests. The diagnosis was early-stage diabetes, caught early enough that lifestyle changes could make a real difference. "If my doctor hadn't checked my feet, I might have gone years without knowing," Leonard shared. "By then, the damage would have been much worse." So, what steps should you take starting today? Wash your feet daily with warm water and mild soap, making sure to dry them thoroughly, especially between your toes, where moisture can hide and cause infections. Inspect your feet regularly for any cuts, sores, discoloration, or changes in temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials to keep your feet dry. Moisturize dry areas of your feet, but avoid putting lotion between your toes to prevent fungal growth. And always pay attention to warning signs. Are your feet dry and cracked? Are there any wounds that don't seem to heal? Have you noticed unusual color changes or a loss of feeling? These aren't just small cosmetic problems. They could be signs of serious health issues that need immediate medical attention. Research has shown that nearly 40% of adverse drug reactions in seniors first appear as changes in personal hygiene needs, well before more serious symptoms develop. Let me share the story of Kathleen, a 67-year-old retired nurse from Florida. Kathleen's family initially thought her unusual body odor was simply a hygiene issue. However, her geriatrician quickly recognized it as a sign of medication toxicity that was quietly damaging her liver. "I was showering every day and using deodorant," Kathleen explained. "I had no idea the smell was coming from inside my body, and not because of poor hygiene." Her experience highlights just how important it is to stay alert to these subtle changes. What can you do to protect yourself? Start by keeping a simple journal after beginning any new medication. Make notes about any changes you notice, such as differences in body odor, increased sweating, dry mouth, or unusual skin changes. Staying properly hydrated can also help, unless your doctor advises otherwise. If you observe any new or unusual symptoms, especially changes in how you smell or sweat, report them to your doctor right away. These early signs could point to serious medication reactions that need prompt attention. And remember, never adjust your medication dosages on your own, even if you suspect they're causing problems. Always work closely with your healthcare provider to stay safe. Have you recently noticed unusual body odor despite regular bathing? Or perhaps you've experienced excessive sweating or persistent mouth dryness? Please don't dismiss these symptoms as just another part of aging. They could be your body's way of warning you about something much more serious. Now that you know the 7 critical hygiene mistakes doctors immediately notice in elderly patients and how to correct them, you have the power to take action today. By addressing these issues early, you can protect your health, preserve your independence, and possibly add vibrant years to your life. Proper hygiene isn't just about looking good or social etiquette. It's a vital part of maintaining your overall health as you grow older. These small but important changes could literally save your life. If you found this information helpful, please hit the like button. Has your doctor ever spotted a hidden health issue through hygiene changes? Share your experience in the comments below. And don't forget to subscribe and hit the notification bell to receive more life-saving health tips. Please share this video with your loved ones over 60. It could make all the difference for them too.